Hi, my name is Gurleen Khaira. I'm from Khaira Education Private Limited. We're an OET premium preparation provider. Um, 5 providers worldwide have achieved the premium status so far, and in Asia, we're the only ones to have done that. Today, I'm making this video to talk about the speaking subtest. Uh, I will talk about the assessment criteria, that is how you're evaluated in the exam. And perhaps in the later part of the video, I will be discussing about some tips which can be useful to all health professionals. Um, for example, introducing yourself using a lively tone, formulating the opening question or statement using the background information given in the cue card, um, they're providing structure while you're completing the tasks given on the cue card, and so forth. So I'm going to start by giving introduction to the OED subtest. An OED subtest is a profession-specific test. It means that if you're a nurse, you'll be enacting the role of nurse and interacting with a patient or a patient's family member, depending on the cue card that you have with you. Likewise, if you're a dentist or a physiotherapist or a pharmacist, you'll be taking on your professional role and performing a role play of 5 minutes. In the OED subtest, you have 2 role plays of approximately 5 minutes duration each. Um, if you haven't looked at a OED subtest so far, you can go to the official OED website, which is www.occupationalenglishTest.org. And in the preparation portal, you will find 3 sample tests. So that will be a good introduction to how the tests look like and understanding the format. Um, so you are evaluated on 5 parameters. The first is the first is overall communicative effectiveness. It simply means whether you're able to maintain a meaningful interaction. The second one is about intelligibility. Intelligibility is concerned with impact of features such as intonation. Intonation is about the adjustment of pitch while you're talking. Um, and then features like pronunciation, sentence stress, the rhythm, and etc. So that's about intelligibility. The third is fluency, which is the rate of your speech when you're speaking. Um, I think one of the challenging areas for my students sometimes can be speaking too fast. They have a tendency to cram phrases and then probably just deliver it rapidly without pausing in between, without breaking it down to meaningful chunks, and it which is problematic for the listener because it impacts their understanding and comprehension. Similarly, if you speak too slow, it can make the listener frustrated. So you need to develop an awareness about if your fluency is okay and understandable by the listener. The fourth assessment criteria is appropriateness of language, which means that you have to use professional language, but it needs to be patient friendly. So, if you're explaining a medical condition, avoid using medical terminology or medical jargon because um, you should think of it from the patient's perspective. Since they're not from a health background, they would have a difficult time in understanding medical terms, so you need to kind of practice explaining medical conditions in a simple language that is understandable by the patient. And the final criteria is your grammar, expressions of grammar. Um, well, for this, you should practice um, using a variety of tenses while you're speaking. Practice using paraphrasing. I think as long as it does not impact or impede the communication in any way, some errors are okay. But a good idea is to undertake practice while you formulate questions because students have a difficult time in the word order when they're using interrogative sentences. So this was about the assessment criteria. Now I will talk about stages of role play. Um, the first part of the role play is always about introducing yourself. Um, well, in this part, you have to receive the patient, you have to welcome them in a lively tone, and you greet the patient with respect. Um, it, this is important because even in a real consultation, you would be you would try to make the patient feel comfortable. You would try to establish a rapport with the patient. So that is why it's important to greet your patient nicely. Some standard expressions you can use are, for example, hello, my name is so and so. I will be your attending nurse today. Or, hello, my name is XYZ, and I am one of the registered nurses in this facility. Or, hello, or good afternoon, or use the time of the day as a reference. Good evening, my name is so and so. I will be looking after you today. Um, the next step is to ask for the patient's name. And you can do this by saying, can you give me your name, please? Or may I know your name, please? And something that I tell my students is that they should ask the patient how he or she would like to be addressed. In other words, it's asking the patient whether they would be whether they would like to be addressed with their first name or last name. It's not mandatory to do this. I think it's simply a matter of courtesy and respect. For example, I prefer to be called by my last name. So Miss Khaira is how I prefer to be called. But it's not very crucial. So don't really fret if you don't do this in your speaking practice. So if you want to ask about the patient's preference for the name, you can use expressions like, what would you prefer to be called? Or how may I address you? After you have clarified your role and your name and asked for the patient's name as well, the next step is to formulate the opening question or statement. Now, you will have to use the background information on your cue card to do this. You will have a variety of cue cards with different background information, and I'm going to explain by using different examples. For example, if your background information does not outline the reason for presentation, in that case, you can ask an open question that will kind of open up the discussion about why the patient has come to you. So you can ask, what brings you here today? Or how can I help you? Or what seems to be bothering you today? If the patient is admitted in the hospital, you can say, I see that you rang the buzzer. Can you tell me what seems to be bothering you? Or can you tell me how may I help you? So these are examples where you do not know what the reason, if the reason has not been outlined in the background information. However, you may have some cue cards in which the reason or some kind of background information is already given. For example, if the background information states that the patient has been referred to you by his or her general practitioner because they have been diagnosed with hypertension. In that case, you can formulate opening question or statement accordingly. For example, am I right in thinking that you have been referred by your GP? Or am I right in thinking that you're here for lifestyle advice about hypertension? So in that case, because it's a time-sensitive test, so you have to utilize your time in an optimal way, and we'll use the background information to formulate our opening statement or question. You can sometimes even pick up cues from the background information. For example, if the background information suggests that the patient has an emotional reaction, the patient seems worried or concerned or anxious, use that to probe into the issue further. For instance, you can say, I can see that you seem very anxious, or I can see that you seem frustrated, or I can see that you're agitated. Could you tell me what seems to be the problem? So these are some examples using which you can formulate the, um, the statement or the question, which will lead the discussion further. And it'll help you take the initiative as well. Now, the next thing is carrying out the agenda or completing the tasks that are given to you on the cue card. Since you only have 5 minutes, you should plan in your mind how you're going to execute all the tasks. Have some idea about how you're going to structure and you're going to complete all the tasks in 5 minutes. Although, as I mentioned earlier, this is not um, that's very important. Rather, concentrate on patient-centered communication. So, meeting the patient's emotional, physical, and mental needs is your goal here. Um, so what I tell my students to do when they are performing the role play is that they can use signposting language to um, provide structure to the tasks. For example, they can take the initiative and kind of outline how they're gonna um, perform the sequence or the schedule of tasks that are given to them. So let's assume that your cue card has 4 tasks. In the first one, you have to find out about the presenting complaint and symptoms. The second is to inquire about the medical or social history. The third is to explain the medical condition or the diagnosis. And the fourth is to explain some advice about lifestyle management and persuade the patient to comply with your advice. So what you can do is, after you have introduced yourself, clarified your role, ask the patient's name, and use the background information to ask your opening question. Then you can use a statement like, okay, what I'm going to do is, first, I would like to ask you some questions about your condition to get a detailed understanding. Then I'd like to ask you some questions about your lifestyle, following which I will explain what the condition is and the steps you can take to manage your condition. Or you can say, okay, here's what I'm going to do. First, I will do this. First, I will ask you some questions. Later, I will discuss what the diagnosis is. And finally, I will be able to give you some suggestions on managing your condition better. And the most important thing here is to take the patient's agreement to check with the patient if they're okay with this. So use questions like, is that okay with you? Or is that all right? May I do that? And only when the patient confirms, when the patient accepts your proposed plan of action, you should proceed further. So I'm gonna end the video here, but tomorrow I'll be uploading another video in which I will discuss perhaps one cue card and the and what you're expected to produce to get a B grade according to the OET assessment criteria. So thank you for watching. And if you're a nurse and you're preparing for the OET exam and you need some sample tests for preparation of writing and speaking modules, you can purchase my book. This is called OET Speaking and Writing Made Easy for Nurses by Gurleen Khaira, and it's available on Amazon. So yes, thank you for watching.